This demonstration video presents guidelines for collecting MEG and EEG data with Electroneuromag Triux or Triux Neo systems and Data Acquisition Software Release 6, providing guidance for performing the most common MEG data acquisition setups. Please review this demonstration video together with MEGIN guidelines to MEG data acquisition for important safety information. Be aware that some of the equipment shown in the video may differ from what is installed at individual sites and is for general demonstration only. Training for site-specific details is carried out by a certified MEGIN trainer during hands-on training. Here we present a general workflow for MEG-EEG data acquisition. In this demonstration video, we will guide the user through the necessary steps to prepare the patient. First, let's check the head circumference of your patient. According to the AC-MEG's Clinical Practice Guideline 1, because of a fixed headspace in the MEG system helmet, it is worthwhile to measure the patient's head using a replica helmet before a study. Alternatively, this can be accomplished during an initial noise screening run, before electrodes are applied. It must be kept in mind that EEG electrodes, particularly when applied via EEG caps, may add to the head circumference significantly and lead to the inability to position the head appropriately in the helmet. In addition, measure the head size of the patient. If the size is greater than 60 centimeters, it is recommended to dry fit the EEG cap and test that the patient fits in the helmet, either by moving them into the MEG helmet or checking with the replica helmet. Next, check the patient for sources of artifact. Permanently magnetized objects generate very strong nearby magnetic fields which may cause visible artifacts. Therefore, magnetized objects should be avoided in the vicinity of the sensors, and you need to ask the patient to remove all metal objects he or she is wearing. Remember especially hairpins, watches, and jewellery worn on the head. Wearing special clothing without any hooks, etc. may be necessary since all ferromagnetic materials cause magnetic artifacts. Remove makeup and any hair products. Degauss metal fillings, if a degaussing coil is available. Place the subject into the MEG system for a brief acquisition to screen for sources of artifact. Move the subject into the MSR and position the head inside the sensor helmet. Close the door and review the sensor traces. Ask the subject to blink eyes, open and close mouth and take a few deep breaths. Identify any artifacts and eliminate if possible. Next, apply the EEG, EOG, ECG and/or EMG electrodes according to the experimental design or clinical protocol. According to the AC-MEG's Clinical Practice Guideline 1, it is highly recommended that EEG be recorded simultaneously with MEG. This should be considered a standard approach in epilepsy evaluations because these techniques provide complementary information and the highest yield when competently combined. It is recommended that EEG data be recorded using a common reference electrode, which will provide maximal reviewing and secondary processing flexibility. Magnetoencephalography compatible, that is, non-magnetic or minimally magnetic EEG electrodes and lead wires should be used according to the well-established EEG practice. Use only MEG compatible electrodes. Clean and abrade the area before applying the electrodes. Use conductive paste or gel and secure the electrode with tape or self-adhesive. Hair should be clean and dry. Use a cap or individual electrodes. If using a cap, head size should be used to determine which cap is appropriate for the patient. The caps are marked accordingly. Measure the positions of several electrodes, for example FP1, CZ and O2 for correct placement of the cap. See the EEG cap user's manual for more details. Correct positioning of the EEG cap is very important. Here we measure where the electrode CZ should be positioned, halfway between the Nasion and Inion, and halfway between the left and right pre-auricular points. Using marked electrode positions as a guide, cap should be fit to the head and secured with the chin strap. Check and adjust position as needed. Ensure the cap is fit with the central electrodes oriented along the midline of the subject. Verify that the central electrodes are correctly placed. Here we verify the position of electrode CZ. Clean and abrade the skin. For the reference, place electrode according to the experimental design or on the nose. For ground, place electrode on the forearm, on the same side as the stimulus if using electric stimulation, or on the shoulder, preferably over a bone. For EOG, place 4 electrodes, one on each side of the eyes for horizontal, and one each above and below the subject's right eye for vertical. Note, this could also be the left eye if the plugs for the electrodes are on the left side of the MEG system. For ECG, place 2 electrodes, one on each side of the chest, near the clavicles. Prepare each electrode site for minimum impedance and good signal-to-noise. Before applying the electrodes or inserting the gel, clean and abrade the area using a cotton-tipped swab and a skin prep agent, for example, New Prep. Circular motion works best. Insert EEG paste into electrode holes, making good contact with the scalp. Care should be taken not to use too much paste, or undesired bridging may occur between electrodes. Next, apply the HBI coils. The HBI coils should be placed as high as possible so that they will be covered by MEG sensors. Attach preferably on skin instead of hair when not using the cap to prevent movement. Note, if internal active shielding IAS is used, the coils should not be directly under the IAS reference channels. In other words, they should not be in the middle of the forehead, on the inion, or near the pre-auricular points. See the Internal Active Shielding User's Manual for more details. Place the HBI coils in the hardware order shown here. Blue, left posterior, behind ear as high as possible along the hairline. White, left forehead. Red, middle forehead, or just off midline if using IAS. Black, right forehead. Yellow, right posterior, behind ear as high as possible along the hairline. Next, digitize landmarks, HBI coils, EEG coils, and head shape. The digitization can be performed in seated position, in the digitization chair, or in supine position on the couch. Place the goggles firmly on the patient's head and tighten the strap. Digitization can be performed with 1 or 2 users. It is more common to have one user point and click to collect points, but for 2 users, one user will point and one will click. See the Data Acquisition Software User's Manual for more details. Mark cardinal landmarks. It is helpful later for MEG MRI co-registration if the cardinal landmark locations are marked with a skin marking pen and photos are taken of these locations and saved with the data according to Ethics Board's rules for anonymizing data. Be sure to collect those points by selecting the marked location. In addition, it is helpful if the last 3 points of additional data are collected at the cardinal landmark locations. Select Coordinate Frame Alignment button, select LPA, Nasion, RPA according to marked locations. To ensure proper placement of the midline in the head coordinate system, the absolute value of the measured LPA and RPA should not differ more than 5 mm in the X direction. select HBI coils button. Digitize in order blue, white, red, black, yellow. It is recommended to check the quality of the points being collected. Select Coordinate Frame Alignment button. Press Check to repeat the landmark digitization and compare against the previous values. Distances from the first digitization should be less than 5 mm. Now, move to digitize the EEG electrodes and extra head shape points. Select EEG Electrodes button. Select suitable EEG cap or head box. Select the sequence defined in Neuro DACQ EEG digitization maps. Digitize the reference electrode. Digitize scalp electrodes. Select the Pen button under Additional Data. Digitize at least 100 extra points, especially on the nose, around the eyes, and on the scalp to capture the head shape. Select File, Save Preparation to save the subject preparation to the disk. Typically, this preparation will be used immediately, but in the case the subject preparation is performed on another computer, or a backup is desired, it is necessary to save this preparation to the disk. You will be informed about the name given to the preparation. The name is of the form project name, subject name, date, time. When using EEG, it is important to check the impedances. This can be done when moving the patient to the MSR. First, check the impedances and then position the head in the helmet. Move the patient to the MSR and plug in the EEG cable, ground and reference electrodes. Select Go and browse through the EEG channels. Check EEG impedances by selecting the checkbox in the EEG impedance check dialog. The dialog should appear automatically when EEG is selected in the acquisition settings. Fix poor connections so that all channels have impedances of less than 5 kiloohms. If the patient has not already been moved into the MSR, assist the patient onto the bed or chair. The patient should be sitting or lying comfortably as close to the sensors as possible, with the top of the head touching the inside top of the helmet if possible. Use cushions to support the head if necessary. See the patient positioning instructions for use for details. Plug in EEG, ECG, EOG and/or EMG. ECG 001 equals ECG. EOG 002 equals vertical EOG. EOG 003 equals horizontal EOG. Plug in the HBI coils. Instruct the patient about the intercom and video system. Check that you can see the patient inside the MSR on the video monitor. Close the door and turn on the intercom system. Check the setting of the intercom. Be sure the intercom is set so the investigator can hear the subject and the subject does not hear outside the MSR except for explicit instructions. In this video, we walked the user through the steps for preparing the patient. Now it's time to record some MEG data. This demonstration video was prepared according to Megin's Guidelines to MEG Data Acquisition. Please refer to this document for additional details and safety information.